What's up, guys? Today we are talking kids, chiropractic, and ear infections.
How can I help you today?
All right, so the question of the day comes from Maria, and Maria asks, hey, Dr. Beau, can chiropractic help out with kids' ear infections? Maria, this is a very interesting topic, and it is something that I have literally seen miracles happen in my practice. So first off, let's talk about ear infections. Let's talk about chiropractic, how the two can or are not related, and then I'll hopefully give you a better understanding. So if your little one is experiencing an ear infection, you'll know what to do. So a couple of things first off, we have to kind of talk about anatomy. And the anatomy of an adult is a little bit different than an anatomy of a child. And here's what I mean. What we are actually talking about is an area inside your ear that drains between your ear and the back of your throat, so to speak, called your eustachian tube. And your eustachian tube is supposed to be at a 45-degree angle. Matter of fact, it sits here. If you think about it, it's draining to the back, almost like two things that go down like that. And in adults, eustachian tubes are typically, like I said, at a 45-degree angle. However, when we're dealing with children, children do not have as big or as long a face as an adult does. That yes, your face and the bones of your face continue to grow as you get older. What ends up happening is the eustachian tubes are typically start in a more horizontal position. Now, what happens with an ear infection is bacteria gets entered into the ear from an outside source usually. So, from a million different things. These are kids that happen to this. And the bacteria ends up staying stagnant inside the eustachian tube, meaning this, it does not drain down the back and then go down the back of the throat into the stomach to ultimately be killed by the stomach's acidic environment. So what happens is that bacteria enters into the ear and it stays like a safe harbor, so to speak, in the eustachian tube, and water and fluid is in that area, and it's a warm, dark environment. And we know that warm, dark environments typically accelerate growth, and the eustachian tube swells, becomes inflamed, bacteria forms, and boom, now you have an inner ear infection. So the question is, how does this relate to chiropractic, and what can chiropractic do about it? Now, I have my little spine here, so I'm going to pull this guy up here so we have a little bit better understanding of what's happening. So this is the side view of the spine. This is the front view of the spine here. And the reason that chiropractic has been shown to be effective in helping to manage kids with ear infections has to do with a couple of things. First off, we as chiropractors are very concerned with the alignment of the spine. And here's why. Like I said, so this is me here, and I was having an ear infection on this side, and we had misalignments of the spine here, and it actually had stuff that shifted the neck this way, and the eustachian tube was horizontal, and this was pushed this way. Could you see, Maria, how there could be a little bit almost of like a depression or like a harbor that could be created in the inner ear? If that's the case, that is kind of a breeding ground for more bacterial infections. Matter of fact, your medical doctor or your pediatrician, if your child should have multiple ear infections, will talk to you about starting to put tubes in their ears. And what tubes do is it causes the eustachian tube to open up, to artificially be open more, so it increases the drainage down into the back of the throat. Now, what we as chiropractors believe in, and what we as chiropractors have seen in our office, is if we have that safe harbor like we're talking about, and we can adjust the bones back into proper alignment, it can help the body to clear out, or actually help, basically getting the ball rolling back downhill, so to speak, to clear out the bacteria that is in the eustachian tubes. So how do we do that? Well, we as chiropractors, obviously, we're trained to look inside the ear to see if there's infection, to see if the inner ear, or the eustachian tube is swollen. And if so, we will also check the back of the spine here, and we make very gentle adjustments to the bones of the back of the neck, to the cervical spine. Now, what we do when we adjust is very, very easy. It's very soft. Matter of fact, we don't do any big rotational components and big snap, crackle, pops like you typically see when an adult gets adjusted. No, it literally was done with the same amount of pressure as if you would take like a contact and put it in your eye. Most pediatric chiropractors will do very, very minimal adjustments where they're holding or just increasing the space, creating more motion into the joints of the upper cervical spine to help the body naturally get rid of, like I said, and decrease the stagnation in that portion of the eustachian tube and in the neck. Now, there have been studies shown that chiropractic care has been effective for the help and management of chronic or inner ear infection. Matter of fact, I'm going to read from you right here. Let me put my glasses on here for you. It says one study that focused on 46 children under the age of 5 had outstanding findings. The study investigated whether chiropractic adjustments improved symptoms by ear infections. Surprisingly, not surprisingly to me, 93% of children involved saw improved symptoms. Of those, 75 experienced improvement in less than 10 days. Now, what does this mean? It means that patients who have undergone chiropractic care, 93% of them have reported a decrease in symptoms having to do with inner ear infections. It also shows that 75% of those have experienced improvements within 10 days. Now, it's very different than a medical model. The medical model is, hey, you have an infection. I'm going to give you an antibiotic that'll kill the infection, which typically works really, really good, but also comes with a lot of side effects. Or you could say meaning you can combine the two of them together. The chiropractic viewpoint is let's make sure that the eustachian tubes are draining properly by making sure that we have proper alignment in the upper cervical spine. And the research is showing that chiropractic care helps with decreasing the symptoms associated with inner ear infections. All right, Maria, I hope that helps you out. You guys, I have a question for you. Have you ever had a child that has had an ear infection? And if so, have you taken them to a chiropractor? And let me know what type of results that you have seen. So please comment below. Do you believe chiropractic can help with ear infections? I cannot wait to read the comments. As I always do, I will jump in and put my 2 cents as well. Hope you guys find some value with this. I'll talk to you later.